Hello, my name is Dr. Sam Daher. I'm an orthodontist with practices in Montreal, Vancouver, and Calgary. I'm one of the early adopters of the Invisalign technique, and I'm always asked by my patients, what's the difference between braces and Invisalign? It's quite simple. They both perform orthodontic treatment, which is basically straightening the teeth for a better smile and probably more importantly for a better bite. They both work very well. There's obviously pros and cons to each technology. One of the advantages of braces is that it's glued onto the teeth, so it does the job well, and we're not relying on patient compliance. It's the old technique. It's been around for about 100 years. It's not very aesthetic. It's not appealing, especially if adults are trying to straighten their teeth, improve their smile or their bite. One of the other disadvantages of braces is that it can form cavities around the braces or the brackets, especially if braces are on for a couple of years. No matter how well we brush our teeth, we can never clean them very, very well. So bacteria may just stay around braces all around, where the braces are really glued onto the teeth, onto the surface of the teeth. That is called enamel. So technically that can cause decalcification. Not to mention the fact that patients may sometimes bite onto the bracket, and that can either dislodge the bracket or can break the opposing tooth that is biting into the bracket. Now with Invisalign nowadays works beautifully well, works as well as braces would, and sometimes a little bit better in the right hands. The technology has come a long way early on. There's many misconceptions as to what aligners or what Invisalign in particular can treat. Early on, it was a technology or a technique that was aimed at treating minor crowding. Maybe patients that had treatment in the past had a bit of crowding of the lower front teeth, and aligners can take care of that and align that. But technology has come a long way in the last 17 or 18 years. So Invisalign can treat every type of malocclusion. It can straighten teeth. Again, with proper technique, with proper training, with enough experience, Invisalign can treat anything that braces can. Obviously, one of the main advantages is aesthetics. When the aligners are on, because they're plastic, because they're see-through, patients won't really, or people around you won't see the difference. So it will be fitting. It's almost like it's a custom-made. Here, let me get a little bit closer. It's a custom-made appliance that fits right on top of the teeth. And these aligners, there's a series of them. So each aligner will straighten your teeth one step at a time, a quarter of a millimeter at a time, basically. So you get a series of aligners. You have to wear them 20 to 22 hours a day. You take them out when you eat, if you're having a glass of wine maybe, or if you're having a drink in the evening as well. You can leave them out for a couple of hours in a day. So long as you wear them for 20 to 22 hours a day, you'll get the desired results. These aligners are usually switched once a week or once every 10 days, whatever the case may be, whatever your doctor prescribes. The end result is it will straighten your teeth in increments. So by the end of the treatment, your teeth should be as straight as they can be. The same prescription as braces, the same job that braces would do. So it shouldn't be any difference. One of the disadvantages is that people can sometimes forget to wear the aligners, or they take them out maybe for lunch and forget to put them back until they get home. So really one of the only and the main disadvantages is that sometimes people forget to wear them. Most adults are committed. They take the time off work and they pay for these aligners, so they'll go out of their way to wear the aligners. But the odd time, if you do forget, the system does forgive. Your treatment is not gonna go completely sideways if you forget half a day or a day to wear them. You go back and catch up. Your treatment may be slightly longer, but you certainly can still get the results. Does it work? Absolutely. What is needed for that? You need a doctor who has experience with the system. You need doctors that have treated many patients with the system and figured out all the wrinkles in the system and know how to use them properly. You need to have a patient who's compliant and actually wants to get treatment with aligners. Your visits to the doctor, to the orthodontist, are a lot less frequent, luckily. There's no such thing as emergency, and that's another advantage. There's no broken wires, there's no wires poking, there's no cut and laceration on the inside of the lip or on the cheek. So none of these are issues anymore with the aligners. And while they're on, like I said, because they're plastic see-through, no one around you will know that you're wearing these aligners. And for special occasions, wedding, what have you, you can simply leave them out for a couple of hours. And again, no one is the wiser. No one can tell that you're getting your teeth straightened. So Does it work? Absolutely. Is it a legitimate orthodontic product and system? 100%. Does it work well? Again, on the right hands, it does the exact same thing that braces do. I hope that helps. Have a wonderful day.